Hard to have a bill, there was no money involved, but we had an office pool about where this would end. And I said it would be 220 votes, and that's what we got. I think that gives us a strong hand going into reconciliation with the Senate. At the end of the day, it'll be a consensus of the approach that the House and the Senate took. And I think we're in a good position for that.
Why is it so divisive to do the right thing?
It's so important, and it impacts people's lives directly. So every time you move something over here, there's somebody over there who's going to be impacted either in a positive or negative way. This is a complicated issue. Everybody's for health care, but to build the kind of consensus you need to move forward with something like this is not an easy endeavor. And so you're never going to have a situation where everybody agrees on the right approach to these things. There's just too much diversity of thought. What we've seen in the last month is a great process that brought together a lot of people who care about different things to a consensus position that got us 220 votes. I think, the most important thing is we keep the momentum up and we get this done this year. We cannot afford to let the current broken system undermine our economy.
Representative, I know that you said on the floor the other day that you had a town hall meeting with 10,000 seniors. What did you tell them about the Medicare Advantage aspects of this?
Well, one of the things that currently is really fundamentally unfair is that if you're in regular Medicare, you don't get the same services and funding from the government as Medicare Advantage. What I think we're going to see with this legislation is a level playing field that takes some of the best issues of Medicare Advantage, like being able to not pay out of pocket for preventative screenings, and apply that across the board to everyone in Medicare. And we're going to have a system that stabilizes Medicare, keeps Medicare solvent, which is enormously important, and makes sure that doctors in states like New Mexico continue to take Medicare. If we didn't act on this bill, when those 21% cuts would happen at the end of the year, most doctors in New Mexico would quit taking Medicare. We cannot allow that to happen.
And what do you tell business people that haven't read the bill, that may be concerned that this is going to impose mandates on them that will ruin their business or make them cut jobs?
The provisions in this bill to provide employer-based insurance don't even kick in until you hit a payroll of 500,000. Most of the small businesses I've talked to are in that range of having 100,000 to 500,000 in terms of their payroll. A lot of them can't afford to provide insurance right now, and they would love to. And it's the affordability credits and the tax credits in this legislation that are going to allow those people to provide insurance, sometimes for the first time, sometimes people who've lost it in their businesses. There are a lot of provisions for small business that are really going to help in this legislation.
And what about the self-employed?
It's the same approach, and it'll allow a kind of pooled buying approach to be available to the self-employed and the small businesses that currently, if you're in a big business versus a small business, you get a much better rate in your insurance, and that's because you have access to a much bigger pool. That kind of pooling will be available for small businesses and for the self-employed.
What about the language you added for the